My name is Becky, and back in December I lifted a cooler that was very heavy and I injured my back, and later on that night I was in such extreme pain that the only way I could get relief is to have my husband pull on my leg, and even that didn't really help a whole lot. It was only temporary. I ended up going to the hospital over the weekend, and the hospital couldn't do anything for me. They basically laid me in a bed for a while until I complained and finally gave me morphine, and when I had the morphine it really didn't help any pain relief at all. And when I went to when they sent me home, I came to Dr. Pfeiffer on that Monday, and I had to when I came to him, I couldn't sit at a seat. I had to kneel at the seat. I couldn't sit down at all. I had to lay down in the car to come. And when I arrived at Dr. Pfeiffer, he immediately adjusted me, which he really didn't have I was pretty tight. I couldn't get adjusted real well, but he was working on me, and within the first, I don't know, maybe 2 weeks, I started to be able to sit. And I was using crutches on occasion, and one day he was actually able to adjust me, and I did not need those crutches anymore. I actually walked out without any pain. After several weeks of therapy, he was using the table where it would he would stretch out the disc and things like that. I went in. Got an MRI, which told me that I had a herniated disc, and the doctor that had me do that sent me over to another doctor, and I had already been seeing Dr. Pfeiffer, and I was able to walk, I was able to do a whole lot more. So when I walked into that doctor's office, he was really surprised that I was actually walking, because he had seen the MRI and he was already preparing me for surgery. He was basically going to set a date with me. But he couldn't do that because I didn't have pain. The only thing I was having at the time was I had numbness in my butt down to my leg to my foot. And that numbness was the only thing that visible condition that I had. Dr. Pfeiffer had really worked hard on me, and he has a table now that not only stretches out the disc, but it turns me so that the side that the disc is herniated on can stretch that out, and every time he does it, it feels really good to stretch it out. I really don't have any pain at all. If I do, it's usually because I've worked a little bit too hard, and I just stop working and I follow what Dr. Pfeiffer has said. I haven't had to have any surgery. I'm not on any medications, and I'm able to function fairly well without any pain or discomfort.